our daily sciatica solution for you. Today we have a case of a gentleman, 51-year-old, that had back pain and sciatica, but a quick reminder why we do this. We do this because patient-reported data helps you. What does that mean? When you understand the benefit of the treatment, you understand better how to treat your back pain. Providers do not have to publish outcomes. They do not have to publish the results of their treatments. They should, and they will, but right now they don't have to. If they did, we would have less problems and less confusion and a lot less spending on health care. There's a lot of waste because people are getting treatments that aren't helpful. And better decisions are made by having better information, so that's our goal for you. Case study number 7. 51-year-old male. Back pain, leg pain, aka sciatica, had pain going down the leg. He had the back pain for 4 years. Again, there are very specific metrics that are important. How long you had the problem is very, very, very important. Before seeing us during that 4-year period, this patient saw 3 different doctors, had an MRI and an X-ray with those doctors before he came to see us. He had tried all the standards. He had tried physical therapy, non-steroidal anti-inflammatories. He had 3 cortisone injections directly into his spinal canal to alleviate the sciatica. It did not work. He was taking narcotics. Okay? The typical standard procedure when you have this kind of problem is to do these therapies. He was no better. What's the outcome for these therapies? 0 better, no better. Didn't work. Okay? Typically the next option after that is to have surgery. He chose not to have surgery. He came to see us, the Illinois Back Institute. We have a 9-step sciatica solution. We have a 9-step process to eliminate sciatica. We get an MRI. We do a very specific type of MRI. The MRI, one of our steps, helps us identify what's going on with the vertebrae, what's going on with the disc. And he was identified to have stenosis, a narrowing of the opening where the nerves come out, a narrowing of the spinal canal. He had sciatica. He had the degenerated disc. It's not too uncommon. You have stenosis, you will very often have a degenerated disc. He had the 2 of these. He also had a bulging disc. These were the issues that were causing him the problem. Now, yesterday, I had mentioned that we're going to talk about the study. We're not doing it today. I'm sorry. It's my fault. We're doing it tomorrow. I got caught up doing some other things, and we're going to go through this tomorrow. It's a really, really, really important study. It has a lot of really good information. The most important thing is it's about stenosis, and it's about patients that had stenosis that had surgery, and what the outcome of surgery is. It's very telling, this is. You'll understand very well how to better understand outcomes, number 1, but what you should do if you need surgery. Not a good idea. So he had these situations. He had these things going on. When he started therapy with us, his back pain and his sciatica was an 8. He got 10. Okay? It's a score from 0 to 10. His pain was an 8. 8 is considered severe. He had severe back pain and leg pain. It was consuming his life. We give all our patients a questionnaire. It's called the Oswestry Disability Index. It's a 10-question questionnaire that evaluates how much effect the pain has on your lifestyle. His Oswestry Disability Index was a 52. It's pretty high. It's a pretty high considering all the things he had done. He had done these things, and again, he was no better. Okay? Oswestry was a 52. He was having some trouble. Oswestry is scored from 0 to 100. 0 is minimal pain, 100 is bedbound. There's a moderate disability, a severe disability, what we call crippled from your back pain, which is 60 to 80, and then 80 to 100 is bedbound. He was what we call severely disabled. The pain was affecting his lifestyle, and he was severely disabled as a result of it. Typically, patients that have gone through these therapies and not gotten any better wind up getting a surgeon, and we'll talk about what happens tomorrow when patients have surgery. Okay, the outcomes will surprise you. Will surprise you, I promise. So he came in with an 8, Oswestry 52, went through the therapy. Now the one thing that we know is the longer you have the problem and the higher your score, the more treatments it takes. In his case, it took 40 treatments. went through our 9-step process, 40 treatments, graduated from our program. When he finished our program, his back pain was a 0, completely went away. His Oswestry was a 0, completely went away. Problem completely gone. Problem completely gone, but he had tried all these other things and not gotten better. So what was the outcome? For these, not very good. He was no better. But in our case, doing our 9-step process, and again, we don't use any drugs or any surgery, pain went away, disability completely went away. Now remember this, because tomorrow, when we talk about what happens when patients get surgery for stenosis, you'll be surprised by the outcomes. My goal for you is so you better understand what outcomes are, so you make better decisions. That's why we do this. So if you have any questions, you can fill them in the comments below, and we will answer those tomorrow. But tomorrow we're talking about the study. And I want you to understand what our outcomes are compared to those outcomes. Because sometimes the outcomes in the study are what's considered standard protocol. And you have to know where you fit into standard protocol. If you've done these things and you have not gotten better, we can help. Okay? The outcomes for surgery maybe aren't what you expect. So we'll talk about that tomorrow. Thank you for your time. Have a good day.